Rhinoplasty truths. Do you have to break your nose for a nose job? Hi, welcome to Rohrich Knows Best podcast, helping you become a better and more informed you, especially about rhinoplasty, which we're going to talk about today. And I get this question not infrequently, not on my also my DMs, but also in my practices. Well, you have to break my nose when I have a rhinoplasty. So let's take a deep dive into the myth of the broken nose. And most people, think that, rhinoplasty thinks it's just about the tip or the top of the nose. And many think that breaking the nose is really not a good thing. But honestly, it's part of the reshaping of the nose. And really, modern rhinoplasty is about precision, not trauma. It's about precision rhinoplasty, precision osteotomies, which means carefully controlled reshaping, not of brute force, but micro shaping of the nose, because the nasal pyramid, because the nose is half of it's the bone and half of it's cartilage. So you have to reshape the nose by reshaping the bones. So sometimes you need to do osteotomy, sometimes you don't. But you need to do it as to be a complete rhinoplasty in most cases. Now, even with preservation rhinoplasty, you sometimes will have to reshape the bones. You can do it with piezo, but I prefer to do it with sharp, small little osteotomes. So, when do you use them? When their noses are wide or they're crooked or they're deviated or the bridge is high or too low. It's repositioning, not necessarily breaking it. You're controlling the sculpting of that. And that's really what precision osteotomies do. They are true sculpting and balancing. So really, precision osteotomies are incredible. Look at this patient that had wide nasal bones and refined it by doing precision-controlled, precise osteotomies to control the shape of the nasal vault. So it's analysis, precision, and control. And I think the key is you want to be able to do this in a very proficient manner. And of course, this will just be a very easy lesson on how you want to reshape the dorsum of the nose and how you want to redo it. Because again, half of the nose is bony, half of it is the cartilage. So you want to reshape not only the cartilage, but also the nasal portion. So you want to do it very precisely. And we've looked at this and done anatomic studies to show how small precision osteotomies can be done very carefully in the operating room, where you stay low, stay precise, and you do minimal green stick type of osteotomies, where you're really, really just shaping the nose and doing very precision osteotomies, as you can see here. And you're doing it with a small 2-millimeter puncture, which the incision is imperceptible in these areas. And so you do it in what I call low-to-low manner, and this is done in a rhinoplasty. And it's done with a tap, 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 and then you reshape the nose and refine it. And then you can actually then not only narrow the nasal bones, you can reshape it and really get you a nice shape and contour. As you can see, here's this wide nasal dorsum. And you do medial and lateral osteotomies where you're actually reshaping the inside of the nose, where you're not only narrowing the outside, but also the inside. And I think that's really very powerful, where you're taking the wide nasal bones, and you're actually doing what's called medial osteotomies as well, where you're taking an osteotome and going medially and then also laterally. So you're doing medial, lateral, you're reshaping it, and look how you're narrowing the nasal pyramid and getting a beautiful result. And I think that's really very powerful and very, very finesse shaping of the nose. You're sculpting that tip, you're sculpting that nose. And same patient, narrow nasal bones, but wide dorsal aesthetic lines. So you're actually just doing lateral osteotomies, and you're reshaping the dorsum, you're reshaping the tip, and you're really giving them a very nice, natural-looking nose. And I think that's what you want. You want a natural-looking nose, a natural-looking dorsum, and all of that is part of a rhinoplasty, because it's not just the cartilage, it's also the nasal tip and the nasal dorsum. So you're reshaping the nasal pyramid, reshaping the tip, and giving a beautiful shape to that patient's nose and face. And again, it's all done very beautifully. And here's a beautiful woman with very deviated nose, where you had to not only move the nasal pyramid, the bones, but also the nasal cartilage, where you actually brought it forward. You corrected that nasal pyramid, which is both the nasal bony portion, but also the nasal tip. In this case, done with a septal extension graft. So you're correcting the nasal pyramid, and you're also bringing it over to correct the cartilaginous portion. And so you're getting a beautiful dorsum shape and tip. And I think that's the beauty of doing a finesse rhinoplasty. And it's doing resculpting of the nasal pyramid along with, of course, cartilage reshaping, which you can see in this beautiful woman. And it's really the 5 steps that we've talked about. And really the key is the analysis, the precision of shaping and contouring, and the control you get, the precise control that is unparalleled. The results are predictable, and they're also very refined. And then when you're done, you place a mold, and you reshape the dorsum, and you put it in place, and that stays in place for about 7 days, and you shape it. So in summary, do I have to break the nasal bones? The answer is yes, but it's precision, and it's sculpting of the dorsum with the bones being sculpted in place along with the cartilaginous portion, because that's what gives you that beautiful look. So the key is shape, control, precision gives you an ultimate superior result in rhinoplasty. So it's not breaking, it's sculpting. It's precision, and it really makes it so that it can be truly individualized to give you beauty, structure, and balance. So know before you go, make sure you subscribe to Rohrich Knows Best. We'll give you not only unfiltered truth about rhinoplasty and facial aesthetics, but so much more in these myth-busting, patient-friendly episodes that you'll see 3 times a week. Until next time, enjoy.